I'm Jennifer Campman. I live in Elkton, South Dakota. I work at South Dakota State University and I teach in the early childhood program. I was born with polycystic kidney disease, so I have fluid-filled cysts that grow on their own on my kidneys, and that impairs the function. And so in 2008 I was told without a transplant I would be facing dialysis and a limited lifespan. So I was lucky enough to receive one from my husband. I had a kidney transplant on Christmas Eve 2008 where my husband was my living donor, and the procedures I have done at the Brookings Health System lab are follow-up to make sure that kidney's working properly. He was a good match. We had some issues where that match went from a positive match to a negative match, and I had to have a procedure called plasmapheresis done to reverse that back to a positive match. And after that, it's been going fine. I did have some pre-transplant work done here as well with iron infusions and blood work to make sure that I was ready for the procedure. The care has been the same, and the wonderful people who work here have been the same. What's been great with the change has been the speed of registering. I don't have to go through the whole outpatient registering anymore. It's very smooth and very quick. It maybe takes 2 minutes to get registered to do labs. I just have to call them, tell them when I want to come, and then check in at the ER. It's really quick. And then the space has been fantastic. The change, it's so beautiful and inviting, and there's a proper large waiting room, and the space where you get your labs drawn is really large and lovely. Before it was one little side room where you'd have to wait and sort of amongst people's office furniture, and this has been a great change. I work with the ER receptionist when I come in, and she's lovely and knows what to do and gets me in when I need to get in. And I work with central scheduling to set up my appointments, and again, they're just a breeze to work with, no issues. And I work with all of the lab staff who would be on call that day to draw blood, and they're all wonderful and helpful, and I come enough that most of them know me, and so we have good relationships and ongoing conversations that pick up from the last 3 months I was here, and it's like being with family. I appreciate their relationships they have with their patients. It's very much like family, and that one-on-one interaction. They make me feel very comfortable, especially when it's something unpleasant like having blood taken or waiting for lab results that are tense when it's involving a kidney transplant. And so they take my mind off that, make me feel at ease. Wonderful people. The small system can be very personal. You have good relationships with those people because it's a small staff, and so the more you come, the more you see the same people over and over. I do my physicianing at Avera in Sioux Falls, which is very large, and while they're very good, they don't always have that hometown feel, the small staff, and you see the same people over and over. So that's what I appreciate about Brookings Health. I would recommend Brookings Health System, especially if you're someone who values relationships and getting to know your care providers and feeling like they're taking care of you like you're one of their own family. I would definitely recommend Brookings Health System. As a result of giving me a kidney, he's become an advocate for living donors, and so he does bike rides at long distances. One was from South Dakota to Michigan last year, this year from California to Washington, D.C. And you can look him up, Tony Campman, K-A-M-P-M-A-N-N, at the Living Donor Project, and find out more about his efforts to get more people interested in being living donors.